Okay, so the last part of the reproductive male hormone, we are going to speak about benign prostatic hyperplasia. We have another section about erectile dysfunction. We can address that later on, but this is maybe the third part of the male hormone. We discussed androgen. The second one was anti-androgen. Then the third part will be benign prostatic hyperplasia. I am Dr. Khalid Hassan, a professor of clinical pharmacology and drug therapy. Um, the patient suffer from benign prostatic BPH. The present to the clinic with suffer from the urinary hesitancy, urgency, nocturia, or urine dribbles out of the penis. The patient feel the bladder is full even after voiding. So we have so many symptoms here. We address like simple symptom of the benign prostatic hyperplasia. If the patient left untreated, the patient may come to the clinic after maybe few months or few years, suffer from complications such as CKD, chronic kidney disease, hematuria, urinary incontinence, recurrent urinary tract infection, bladder stone. All these we can see it in the clinical image of prostatic hyperplasia. So we need to treat the patients from benign prostatic hyperplasia in order to avoid complication. And you can see the complication could be life-threatening CKD, chronic kidney disease for the patient. Now we ask ourselves what medication available. Two main medication available for treatment FDA approved for the treatment of benign prostatic hypertrophy or hyperplasia. We have alpha blocker. We covered this one in the first or the second lecture of pharmacology when we talked about the autonomic nervous system. We have terazosin, we have doxazosin, we have alvazocin, tamsulosin, and silodosin. All these with the brand name Flomax, with for example, Cardora, Flomax, and Rabaflow. All these medication block alpha receptor and lead to relaxation of the bladder neck, relaxation of prostate, and alleviate the symptoms. So alpha blocker number one. Number two, we have 5 alpha reductase inhibitor. We have two medication in the list here. We have finasteride, dutasteride, Proscar, and Avodart. So we have two group of medication, two main group, alpha blockers, tamsulosin, for example. We have 5 alpha reductase, finasteride, dutasteride. Sometimes we go with the combination therapy like dutasteride with the tamsulosin, and we have Jalan here or Jalen, dutasteride and tamsulosin combination therapy when you have advanced case of benign prostatic hyperplasia. We have another group of medication. We have the phosphodiesterase inhibitor, phosphodiesterase 5 inhibitor. We have tadalafil, brand name Cialis. Okay, we have all the access here for the medication name. For example, for tamsulosin or tamsulosin, if you click on the link here and they give you the information about, I will click on one medication from each group and share it with you, or only to be familiar with what we have in the clinical practice. And this is what the physician assistant, the nurse will read, the patient will read when you have this prescription. So we have Flomax here, and this is brand name, generic name tamsulosin, capsule 0.4 milligram. And we can see the indication for this Flomax. Flomax tamsulosin is like alpha 1 receptor antagonist, indicated for the treatment of signs symptoms of benign prostatic hyperplasia. Okay. Important issue here, they said Flomax capsule are not indicated for the treatment of hypertension. This is the important notice for us. Okay. We'll go to the one medication from another group, finasteride, for example. I will go to the finasteride here to go the 500 milligram, because 100 milligram we have it here for alopecia, 500 milligram for benign prostatic hypertrophy. Click on this one here again. This is from Merck about the finasteride tablets. And scroll down to the indication. If we have anything else, we can share it with you. a lot of data. We can compare the data, read the data. Indication for Broscar for finasteride, treatment of benign prostatic hypertrophy in men with enlarged prostate. Okay, so please remember here we have several maybe approach for the finasteride. Then we have finasteride 1 milligram. We use it for the treatment for of male baldness. Okay, another one here. Okay, so you can see here propecia for finasteride, propecia, 1 milligram tablet. Okay, this medication indication used for the 5-alpha reductase inhibitor treatment of male pattern hair loss, androgenic alopecia, men only. Okay, so we demonstrate three medication in more details. We have Flomax, tamsulosin. We have finasteride, Broscar, and then we have finasteride as Propecia, 1 milligram and 5 milligram. Here in this slide, we don't go to the details, but here they try to make a category, bring a category for benign prostatic hypertrophy. We have mild symptoms, we have moderate symptoms, severe symptoms. We have different approach, depends on the case. We have score. If the score less than 7, mild symptom, the score between 8 and 19. Moderate symptom more than 20, considered like severe symptoms of benign prostatic hypertrophy. How to treat? So we have the situation here. We need to remember this category here. Number one, if the patient come to the clinic suffer from hyperplasia, benign prostatic hyperplasia with the only symptoms, everything fine, the patient suffer from symptoms only. Okay, so we can prescribe alpha-1 blocker such as tamsulosin. Okay, this is number one. If the patient come to the clinic suffer from large prostate, so this is another case. So when you have only symptoms, we prescribe alpha blocker. When you have a large prostate, okay, and the patient cannot tolerate cardiovascular effect because alpha-1 carry the risk of cardiovascular effects, so we prescribe 5-alpha reductase. So which medication we use if the patient suffers from large prostate? We go with the 5-alpha reductase. If the patient suffers from mild symptoms, go with the alpha-1 blocker. Which medication are going to use if the patient has a history of cardiovascular disease? Go with the 5-alpha reductase. So we have cases here, depend on the approach. Moving. So if the patient come to the clinic suffer from symptoms, severe symptoms and large prostate, we go the combination of treatment between alpha blocker and 5-alpha reductase. Last one, the patient come to the clinic suffer from benign prostatic hyperplasia, but the patient suffer from erectile dysfunction. We go with the prescribe 5-alpha, prescribe phosphodiesterase 5 inhibitor. So we have different approach, as you can see. Symptoms only, alpha-1 blocker, large prostate, 5-alpha reductase, cardiovascular disease, 5-alpha reductase. We have symptoms plus large prostate, go with the combination. Patients suffer from large prostate and erectile dysfunction, go with the phosphodiesterase inhibitor. How this medication work, you can see here alpha blocker. They said alpha blocker relax the bladder neck. Please remember that, relax the muscles, relax the bladder neck, and relax the muscle of prostate, and make the urination possible for the patient. Again, we have it here. We have tamsulosin, silodosin, then we have doxazosin and alfazosin. Effectiveness, this medication, when you prescribe it to your patient, this medication works quickly with a relatively small prostate. So when you prescribe it, take few days, maybe 1, 2, 3 days, but this medication works quickly. We need to remember that. So alpha blocker, relax the bladder neck, relax the prostate, ease the urination, several medication. Effectiveness, this medication works quickly, and we need to remember that with the tamsulosin and silodosin, this medication block alpha 1A receptor. This medication like selective on the bladder neck and on the prostate, with the minimum effect on the blood vessels. Please remember that. Moving to the the 5-alpha reductase. 5-alpha reductase, this medication shrink the prostate. This medication decrease the size of the prostate. So when the patient come to the clinic suffer from large prostate, this is the ideal specific medication. 5-alpha 5-alpha reductase inhibitor for the patients from large prostate, shrink the prostate. Finasteride, dutasteride, two medication in this group could be used to shrink the prostate. Effectiveness, this is an important issue here. When you prescribe 5-alpha reductase finasteride, this will take up to 6 months. They said 3 to 6 months to see the effectiveness of this medication. This medication work quickly, so you can compare now between the two group of medication. Okay, so for selective alpha 1A, so here we talk about blocker, that means block alpha 1A in the bladder neck. We have tamsulosin, and we have alfazosin. Non-selective alpha 1, we have terazosin and doxazosin. So which one block alpha 1, non-selective alpha 1? We have terazosin, doxazosin. Which one block alpha 1A receptor? We have tamsulosin, alfazosin. Okay. Any adverse effect? This medication may cause vasodilation, dropping blood pressure, and the patient suffer from dizziness. So please remember, this group of medication may carry the risk of hypotension. And for this reason, patient may suffer from dizziness. This medication may cause headache and tiredness. And the last one, this group of medication cause retrograde ejaculation, especially with tamsulosin. And what is the definition? What that mean when you're talking about? When you talk about retrograde ejaculation, ejaculation definition mean occur when the semen enter the bladder instead of entering through the penis during orgasm. So the situation here, retrograde ejaculation, the semen will enter the bladder instead of entering the penis during orgasm. So this is important side effect the patient may suffer from with the treatment of tamsulosin. Which of the following medication associated with the retrograde ejaculation? We have tamsulosin. Okay, next group of medication we have 5-alpha reductase. Okay, the next group of medication we have 5-alpha reductase inhibitor. We need to be familiar with the medication name. We have dutasteride, finasteride. We have finasteride propecia. We have finasteride broscar. We have it here like broscar like 5 milligram here. Then finasteride 1 milligram for a hair loss or alopecia. Patient may suffer from reduced sex drive, reduced erection, a change in ejaculation, breast tenderness as a side effect. The benefit, this is an important issue. What are the benefit of 5-alpha reductase inhibitors? Reduce prostate size, improve symptoms, improve urine flow, reduce risk of surgery. This is take effect after 3 to 6 months of treatment. So this the medication considered like long effect, a slow onset of action. This medication may last for 5 years. This medication lower the prostatic specific antigen. So we have a lot of benefit: reduce size, improve symptom, improve urine flow, decrease risk of surgery. But this medication takes 3 to 6 months to start working, but it lasts for 5 years. It lowers the PSA. PSA stands prostate specific antigen. So we have finasteride 5 milligram. We have dutasteride afodart 0.5 milligram. Again, if you need to compare between the two group of medication, alpha blocker and 5-alpha reductase, so which medication, which group of medication decrease the prostate size? 5-alpha reductase. Which of these medication start take maybe 6 to 12 months as a peak of onset of action? The 5-alpha reductase take long time. Here take like less time, 2 to 4 weeks. Which of these medications decrease the prostate specific antigen? The 5-alpha reductase. Which of these medications cause sexual dysfunction? 5-alpha reductase. Which of this medication cause the risk of hypotension? Tamsulosin. Example for the BPH medication, we have tamsulosin and alphazosin for the alpha blocker. We have finasteride, dutasteride for the 5-alpha reductase. Okay, this table here present like algorithm how to treat patients from benign prostatic hypertrophy. If we have mild symptoms here, we don't need to treat, only we need to monitor the patient when you have mild symptoms. When you have moderate to severe symptoms, this moderate to severe symptoms depends on the prostate size. For example, if the prostate size is not large, we go with the alpha blocker only, we address that. If the prostate size suffer from a large prostate size, we go with the combination treatment, for example here. If the patients are from erectile dysfunction, go with the phosphodiesterase inhibitor, and we can add 5-alpha reductase or alpha adrenergic. Depends on the situation. When you have severe symptoms, we go with the surgery. So all these, maybe we need to remember we are dealing with patient, and we need to maybe bring the category for the symptoms here. Look on the symptom. If you have mild symptom, moderate symptoms. Mild symptoms, monitor the patient, no need for treatment. Moderate to severe, look on the prostate size. Do you have large prostate size or small? If you have only small prostate size with the symptoms, go with the alpha. Large prostate size only without symptom, go with the 5-alpha reductase, and so on. Okay, this will conclude our section about, or our lecture about the benign prostatic hyperplasia clinical pharmacology. Thank you so much for your watching, and have a great day, everyone.